Very warm welcome to everyone. My name is Claire Thorne and I'm the Department Graduate Tutor for Research at Great Ormond Street Institute of Child Health. So UCL is also known as London's global university, and we have more than 6,000 academic and research staff across 11 different faculties, 36,000 students at UCL, and among these nearly 6,000 research degree students. And it's a very diverse and vibrant research and student community. So Great Ormond Street Institute of Child Health grew from the Hospital for Sick Children Medical School, which is very long established, and was initially established as part of the University of London back in 1945. And ICH joined University College London in 1995, and then more recently was renamed the UCL Great Ormond Street Institute of Child Health in order to really underscore the extremely close and synergistic relationship that we have with the hospital. So as you heard from Ros, we have these strong links with GOS, and we sit within the Faculty of Population Health Sciences. And as you also heard from Ros, we form the largest concentration of children's health research in Europe. I just wanted to flag a relatively recent addition, which is the Zayed Centre for Research into Rare Diseases in Children, which sits just across the road on Guildford Street from the main institute building. And this allows for pioneering research and clinical care to take place under one roof, has really state-of-the-art facilities, and the goal for the centre is to accelerate progress of new diagnoses, treatments and cures for rare and complex diseases. And we have several PhD students who are based in the centre. So the Institute of Child Health, as I've said, is sits within the Faculty of Population Health Sciences, and you can see the names of the other institutes shown here on this slide. And the faculty is one of the world's leading population health faculties and has over 1,000 students, including 40% of these being PhD students. As you've already heard, but just to reiterate, the mission of Great Ormond Street Institute of Child Health is to improve the health and well-being of children and the adults they will become through world-class research, education and public engagement. So that is where PhD students are really important to us, as well as our academic and research staff. So Ros already went through the different research and teaching departments that we have at the Institute. But I just wanted to also flag some of the thematic strengths that we have within our current strategy. So these are areas where we put a lot of focus and resource, and they include rare diseases. As you heard, I was just talking about the new centre, novel therapies, and also the life course, recognising that the trajectories of our lives are affected by our development right from a fetus through childhood and onwards. We have three main strategic initiatives which are ongoing at the moment. One with a focus on data science, and in fact we have a ring-fenced PhD studentship for data science, stem cell biology and global health. And international partnerships are really critical part of the overall strategy at the Institute. So I just snipped some news articles from the Institute web pages in terms of some of the great research and new findings that have recently come from Institute researchers, including PhD students. This study on antibiotics linked with birth defects was a PhD project. If you're interested in reading more about them, then I direct you to the news pages pages of the Institute, but really it's just to really highlight to you the diversity of the work that's going on by our researchers. So we currently have around 200 research students registered. So that includes MRes students, PhD students, and we have some MD-Res students as well. And this is the largest research student cohort in our faculty, but actually it's also one of the largest cohorts of research degree students by institute, division or department across UCL. We take new registrations from PhD students at any time of year, but the majority tend to register at the start of the academic year, and we've just had around about 30 students, PhD students, start with us, which is great. And as already said, our research students are really central to our mission. I thought you might be interested to see some examples of current PhD projects, and I've listed these here. Obviously, this is just a snapshot, and there are very many others, but they really sort of demonstrate how we can engage with clinical expertise at GOS, but also that it spans global health projects, you know, moving from public health to lab-based projects. So a huge variety of work going on across the different research departments. I also wanted to draw your attention to our PhD student profiles that we have available on our web pages. There are profiles from Diana, Rasib and Laurette, who are all at different stages of their PhDs or undertaking PhDs in slightly different ways. Laurette is a part-time student, for example. And these are some quotes that I've lifted from their profiles, just so that you can hear it sort of in their voice, what they think about doing a PhD at the Institute. And there's some focus on building and expanding research and transferable skills, becoming accessing training and expanding knowledge and employing the tools needed to become an independent researcher. And that's really the crux of what we try to do in our PhD program, is to develop students so that they develop their independence and the skills that they need for that. Working amongst experts leading in their field is seen as a great benefit, and the wealth of training opportunities. But you can read in detail more about what they're doing on the web pages. So I wanted to touch on how we look after our PhD students and what it's like for a PhD student in terms of the day-to-day, because of course it's very different from taught studies where there's you know, lectures and tutorials, etc. So the key aspect is personal supervision by a supervisory team consisting of primary and subsidiary supervisors. Now everyone has at least one and one subsidiary, but some PhD students may have two or more subsidiary supervisors who support in different ways, maybe different technical aspects of the project, for example. We also have thesis committees, which are a relatively new introduction in our school, but this is really of benefit for PhD students, we hope. There are regular meetings between the student and their thesis committee, and it's a chance to receive advice and to present your findings to a group that's a bit more independent from your research, and to be supported from a group that's outside your primary supervisor. We provide personal monitoring by postgraduate tutors, and so there's annual meetings as well as an open door support, so that people can come at any time if they've got a question or a problem. I am the department graduate tutor for research, and I am available also on an open door basis to support students. We also have our research student representatives who act as peer mentors to PhD students, and this is particularly helpful for new PhD students because peer mentors are a really great source of advice and information and support because they've been through it themselves. And then, of course, Stella and Annie are our fantastic administrative team who are there to support in all of those aspects as well. So this slide gives you a screenshot of the Doctoral School website, and really the Doctoral School provides the research degree log, and I'll talk about that in a minute, but also the skills training, including research integrity training, that is a really key component of a PhD. So the Doctoral Skills Development Programme that UCL offers is the largest in Europe. It's open to all research students as part of their registration, and really expands the generic and transferable research skills of the students. And UCL uses the Researcher Development Framework using this wheel or pie you can see here, which highlights different aspects of personal development that we really encourage our students to follow. So although, of course, during your PhD, you will receive very specific research training, we're also very keen that students develop more generic skills training, whether that's personal effectiveness, time management, project management, communication skills, etc. So we really try to utilize this framework, and at the moment, of course, our training is being delivered online, but hopefully in due course we'll be able to get back to face-to-face training as well. UCL also benefits from LinkedIn Learning, which is a really fantastic resource. And just highlighting here, these are some of the top 20 courses that UCL staff and students accessed over the past 3 months. So you can see a very broad range of courses there. So I mentioned the research student log. Here is a screenshot of it, and this is really a tool for students, and it's actually a mandatory part of doing a PhD at UCL. You use it for project managing your PhD project, recording meetings with your supervisor, and recording your skills development. You can use it to define shorter term objectives and then monitor progress, and it's a really useful tool, and you can take it away with you when you leave, when you've completed your PhD. So I just wanted to flag what opportunities are available for our PhD students, and although of course international travel is not very possible at the moment, and certainly a lot of conferences have been happening virtually, we do have a travel and external training awards and conference funds to allow students to present their findings at international or national conferences. And of course, this also applies to remote and virtual conferences in the current era. We have BOG fellowships available at UCL, which provide funding for PhD students to go and spend some time in a lab or a research group in a North American university, which is a really fantastic opportunity that quite a number of our PhD students have been successful in obtaining this fellowship. The the Great Ormond Street Hospital BRC Doctoral Training Support Fund also provides some additional consumable support for students whose research is in the area of translational clinical research and experimental medicine projects. And there's also funding available for public engagement opportunities, and these are available for researchers and students at UCL in the form of Beacon bursaries. But specifically for PhD students, we provide the opportunity to participate in train and engage workshops, which gives you some training in terms of patient involvement and public involvement in research and science, and then you can apply for a grant to put what you've learned into practice. And another example, bursaries to attend the Cheltenham Science Festival. This slide just gives some examples of patient and public engagement activities of current students. You can see Soapbox Science, social hackathons, science museum volunteering, and the 3-minute thesis competition. So the 3MT is something that we run at an institution level, and then it's run at a faculty level, and then a university-wide level, and then there's a national competition. And this is a really great way for students to experience being able to talk about their science and their PhD project in terms that a layman can understand, of course, just in 3 minutes. So it is quite a challenge. UCL runs a Grand Challenges Doctoral Student Small Grant Scheme, which is an exciting opportunity for students from different disciplines and different faculties to work together to get a small grant. And I've shown 2 examples on this slide of 2 of our PhD students who work together with colleagues from biomedical engineering and psychology and human development to conduct a study that was complementary to but additional to their PhD work. In terms of teaching, many PhD students are very keen to have the experience of teaching and supervising undergraduate or MSc students, and UCL is extremely supportive of this and recognises that this is a key factor in terms of professional development and future employability of the PhD students. So we have the UCL Arena 1 training, and this is to support students, whether it's informal teaching, supporting delivery of remote learning, which is really critical at the moment, whether it's laboratory demonstrating or even some supervision of BSc or MSc projects. I've mentioned the 3MT already, but other examples of competitions that are open across UCL for PhD students are the Research Images as Art competition and poster competitions, and I'll come on to say a little bit about the ICH poster exhibition and competition in a moment, but there are also opportunities on a faculty and doctoral school level as well. So when you're embarking on a PhD, of course, the product that everyone thinks of is the thesis, defined as forming a distinct and significant contribution to knowledge of a specific subject. But UCL also wants the product to be a creative, critical, autonomous, intellectual risk taker, and recognizing that although for many of our PhD students, they do end up working in academia, for many, a PhD is equipping them for working in other settings, whether it's industry, government, etc. And the need to provide the students with the research and transferable skills that I have already briefly touched on. In terms of our student voice, this is obviously very important to us, and we have a staff and student consultative committee. This allows us to hear from our students via our reps what they think about the support and the opportunities provided for them, and helps us really to try to improve the student experience at the Institute. We have the ICH Postgrad Society as well, which is providing social events for our students. Unfortunately, obviously the face-to-face events aren't happening at the moment, but the most recent thing they did last month was a virtual Pictionary competition with prizes. I'd like to highlight the blog that our PhD students contribute to, PhD Journeys. Here you can see some of the titles of the blog articles in recent times, and I think if you read these, they give you a really good insight into what it's like doing a PhD from the student's perspective. And that includes our student Artemis, who wrote recently a blog, well, 2 blog articles on being productive during a global pandemic, which are quite interesting reads. Another PhD student has set up our We Are the UCL Great Ormond Street Institute of Child Health podcasts. And so again, if you're interested in the research going on at the Institute, then I suggest that you tune into SoundCloud and listen to these episodes. Ros, in her welcome, already mentioned the fantastic news that the Institute's just been awarded a Gold Athena Swan Award, and really trying to working hard to ensure the diversity amongst our PhD students, and making sure that our students as well as staff have a voice in terms of the community in which we work is really important to us. And so we have a lot of close working with the EDI group. So that is hopefully giving you a bit of a taster of various facets of PhD life at the Institute. And now, as I know from the registration data, that many of you are interested in applying for our Child Health Research PhD Studentships. The current call is out at the moment. So just in brief, this studentship scheme is for high caliber students who wish to pursue a career in, obviously, child health research. They're funded for 3 years, and there's a great portfolio of projects available, which I hope you've had a chance to look at. The closing date for applications is the 27th of November, and we will be holding interviews in the middle of March. And this is obviously for students who would be starting in just under a year's time, so starting in October 2021. I also just wanted to flag some other PhD studentships. The UCL-Birkbeck MRC DTP is a 4-year studentship program. So it involves 1 year where rotation projects, 3 rotation projects are undertaken, and then the 3-year PhD follows. And the themes of this DTP are shown here on the slide, but basically they cover all the aspects of work that we have at the Institute, and we've got several PhD students at the Institute who are part of this program, because the great thing about this program is that you can, if you are awarded a studentship, then you can shop around, try different rotations, and really develop a project that suits you in whichever institute suits you. And then there is the BBSRC London Interdisciplinary Doctoral Programme, or LIDO. That again is another 4-year programme. is open now, closes on the 22nd of January, and it includes a subgroup of PhDs called IK Studentships, and these involve as a integral component an industry placement. And then there can be miscellaneous advertised students throughout the year, which are advertised through Find a PhD or the UCL web pages. I just wanted to flag also the UCL Overseas Research Scholarships. So these are open at the moment. The deadline is the 13th of January. And what these scholarships do is give the difference between the UK tuition rate fee and the overseas tuition rate fee. So the way it works is that if you're an interested student, you need to apply to us as an institute together with a project and a potential supervisor. And then from amongst the applications we receive, we nominate our two top candidates to UCL, and then there's a selection across the whole of the university. And I just wanted to flag that although there are still some questions remaining about pre-settled or settled status in EU students will be liable for international fees from the next academic year. So the ORS is something that some students who previously wouldn't have thought of it, you know, this is something that you might need to consider. But thank you so much for your interest and for joining and for the great questions, and good luck with your applications, and yeah, and everyone take care. Thanks very much.